Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Happy Q&A day, everybody. We like to celebrate members' wins in the program. So this week we are celebrating, she started the program at 62 out of 132 and is down to 12 in 6 months. So congratulations to And Marianne, who started the program at 57 out of 132, is also down to 12 in 4 months. So congratulations to both of those members. And we can go to the first question with...
Good morning. Still struggling substantially over a year, and I have done just about everything under the sun. Obviously, I'm complicated because I have the eye injury and the brain concussion. So my question today is dealing with the eye coordination with the brain. I mean, I've done, all the, vestibular for months and months and months, blah, blah, blah. I've done everything under the sun. So is there something more specific that I can do or consider? I really kind of think it's the, I'm feeling most of my pain around my eye, not the eyeball itself. My vision the acuity is fine. It's the pressure around the head and the eye. My whole head just pounds all day long. So there's just got to be something, I think, related to the eye. And is there any ideas on that?
Yeah, usually that's neck. Have you done neck work?
I have quite a bit. Open to additional ideas, though.
What kind of neck work?
Well, I've been to the chiropractor, and he's done, I don't do the adjustments because that would be too stressful for me, but he's done substantial therapy there and on inside my mouth. I've done brain tap. I've done, that's the wrong one. ARP wave, which is neurological therapy you can use for just about anything in your body. I don't think massage is in and of itself is going to really fix the problem. But if you've had success with that, I mean, I just don't know what do I need to do with the neck? I mean, what type of?
Usually it's soft tissue, but when you get treatment on your neck, are they able to recreate the eye pain and pressure?
Not necessarily, no.
So either they're missing it, right? Not getting to the right spots. Or, I mean, it could also be an actual eye issue. Have you had an eye exam done?
Bazillions, yes.
So then there's nothing wrong with the eyes?
No.
Yeah, so usually that's a neck problem. And if they're not able to recreate it when they're doing their assessment or treatment, it means that they're not hitting the right spots. usually pressure in around the eye is due to issues with the neck. And headaches, constant headaches, right? I did a session on headaches a while back. And if you just look at like headache types, like a constant kind of headache is generally a neck-related headache.
Well, that's what
So-
I've got, a constant headache 24/7, sometimes a little more severe than others.
Right.
I mean, obviously I had
Where are you at? Where are you at in the program?
Oh, I've been through the whole thing a year ago, and I still, do bits and pieces.
Have you gone back through it again?
I have a couple times.
Have you done the new 2.0 yet?
No, I have not.
Okay. So what we generally recommend is that once you've done the program, and if you're still having issues, just go back to the start, because each time you do it, if you do it fully and you're not just rushing through being like, yeah, I know that, but you actually go, okay, I'm going to just do this again. You'll continue to just shave things off. And you'll continue to pick up things that you may have missed the first go around, or stuff that you've kind of let slide over time. And it just kind of keeps things, going in the right direction. So I would recommend you do that and go back through at least like the new version too as well, because there's a lot more kind of information in there. But yeah, to me, it sounds like it's probably a neck issue, but you haven't hit the right practitioner or the right thing. Now, you mentioned that you haven't done adjustments because it'd be too stressful for you. Why is that?
Oh, I've done so much chiropractic. It just scared. No, I can't afford to have them break my neck. I won't do it.
Break your neck. Okay.
No, my neck has always been so tight, and then I have so much pain for days and days and days after a neck adjustment. I can't do it.
Okay.
So that is not. So going back to your 2.0, I mean, I am under multiple doctors for diet, meditation, you name it. What I do when I walk every day, I do my eye I do my eye movements all the time. So what different things might I expect in the 2.0?
Well, I mean, you'll have to go through it. I mean, it's tough to explain what you're going to, get differently out of a program that's 30 hours long. But still, there's something missing. If you're having symptoms continually, there's something missing. What is it? Well, there could be other factors, right? So there could be, Paul, you're going to go ahead.
Yeah, let me ask a couple questions here, Anne, because I know you've shared previously, right? So I forget all the details of that particular conversation. But let me ask a couple questions. So you said your main symptom is the pain behind your eyes. Can you just describe that one more time, please?
It's not necessarily in the eyeball or behind the eye. It's all around the eye. I had orbital bone fracture all around my left eye.
So here, like around the eye, like.
Yes, it's all up and down and to the side. My temporal, area is sunken in. It's yeah, there was a lot of damage around
Right.
the eye.
So
Now,
yes.
the thing is, it didn't hurt at all for 2 months. And then I woke up one day, and that's when I had all my pain, all my imbalance, all my, and my vision has been improving every month, acuity-wise, but now I'm finding my two eyes they never did really work well together, but they're getting worse because I think my right eye, my good eye, is getting lazy because my left eye is stronger than it was for months and months. But if from a neck, so you want to focus on the neck, I'm thinking, what recommend? I mean, is it massage? Is it going to therapy? What can they do to go deep enough and correct some of that? I can go back to the chiropractor and he can go deeper again, but I'm not sure what else.
If that one wasn't getting to it, why would you go back to the same one, right? You'd want to probably find somebody different, right? Different set of hands. Everybody has a different style to it, right? So you kind of got to find one that fits. Now, I wasn't aware of the orbital bone fracture, right? So that could be creating some complications where you actually have just the way that when bones heal, they tend to form calluses, right? Which is maybe why you didn't experience this right away. But the bone, when it heals, actually becomes a bit thicker. And now it could be putting pressure on some things. in that area. So it could be something due to the actual fracture itself. So there could be more to this, right? So
I agree. Agree.
Initially I was suggesting eye or neck because that's usually what people have. But if there's a fracture involved, okay, now that changes what we might be thinking. So neck could be a issue, but it also could be some of the just musculature around the face because of that fracture, or maybe it's putting some pressure on some nerves or some tissue. But you mentioned headaches kind of everywhere, right? Not just in that one spot.
Yeah, it seems to mostly be along the left side of my eye, where the temporal artery is, and but there's, I wake up in the morning and my whole front of my face is pounding.
Just on the one side where the fracture?
No, but I feel pain everywhere. More severe on the left, of course, but it radiates, I think, out. And then, of course, if you have sinus day, with weather, whatever, it makes everything even worse. Now, I did just have a biofiller procedure a month ago, and I was feeling bad beforehand. I was feeling bad afterwards. My doctor had recommended it to not to fill the spot, but also to heal, internally. I don't know whether that's going to work or not, but I do think it's okay. So the question I have is, I've had the eye injury, the orbital bone fractures. Of course, I've got the brain concussion. Brain concussion, we know more or less the cells have repaired, right, at this point in time. But is there still something related to the brain and the eye connection in terms of from a brain concussion perspective that I need to think about?
Well, the way I kind of think about it is that concussion occurs, right?
Mm-hmm.
And then it resolves.
Right.
Right. The symptoms that people experience afterwards are not due to like ongoing brain injury. They're due to other factors. So, but your brain is where signals get integrated. So if you think about visual, vestibular, and neck as being a triangle, all three of those inputs have to be consistent for your brain to be able to make sense of those signals, because your brain integrates all three of those together. If one of those systems is giving a different signal than the other two, you will feel off and there will be a disconnect there. So that can result in eye movement issues, that can result in dizziness and balance issues, that can result in, a whole bunch of different kind of weird feelings and sensations because you're not getting congruency from those three signals. So which one or two is giving you the false information? So it's not necessarily that the brain is the problem. Your brain just can't process the incorrect information it's receiving. So you have to think about it that it's not due to the brain, right? Even headaches, people assume that headaches are due to brain. Your brain can't feel pain. The brain does not have sensory fibers within it to be able to sense pain. So how could a headache be due to the brain?
Agree.
It
The
can't.
key is, do I focus in on the eye or the neck and
It could be a combination of both, right? So if people have eye movement issues, right, that could be a neurooptometry thing, right? Vestibular, you've done it for a while and it's not working. I don't think vestibular is the problem. But this is the problem with concussion, is that if anyone describes anything dizziness related, they get referred for vestibular PT and they spend months and months doing it and nothing's going on. Right? The research shows that vestibular rehab in patients after concussion with dizziness is less than 50% effective. It's between 25 to 50% effective. That means that 50 to 75% of the time, vestibular therapy is not going to work for people with dizziness after concussion. The reason is because of neck dysfunction and visual dysfunction that's not being considered by your vestibular PT. So the way to do it is to actually kind of do all three. But because you've done vestibular, my thinking is that it's something related to either vision or the neck.
Agree. I think it's both, but I don't know what the next steps should be.
Well, it's working on both. But also you have to make sure that you have a really solid foundation, right? Like, what's your inflammation look like? What's your sleep patterns look like? What's your mental health status look like? All of those things have to be solid before rehab will work anyway. So that's where going through the 2.0 kind of lets you reestablish that foundation again. kind of get things back on track. There could also be a situation where you have too many cooks in the kitchen right now, where if you're seeing all these different people for all these different pieces, you kind of start to get conflicting information and you're trying to keep up with all these different appointments. Sometimes it's better just to pare that back and say, okay, look, I'm going to focus on Concussion Fix 2.0, and I'm going to find a really good vestibular or a really good vision therapist and a really good manual therapist that can do really good tissue work on my neck. And now you're working on both of those things. Now, if it's something with the facial structure because of the fracture, you may need somebody who deals in that, right? You may need some, work around some of the musculature within the face itself. There could be some TMJ. Actually, I wouldn't be surprised if there's TMJ, just given the temporal headaches and where that pain is. So there could be, you might need somebody that is good with necks and headaches on the manual therapy side, but also somebody that's good with kind of facial and TMJ, because that might be a component to it too. And at the same time, you're also now doing eye movement exercises. So when you say you're out and walking, the challenge is that if you have neck dysfunction, you're like, every time I go out, I'm working on my eye movement exercises and I'm doing all this stuff. If you have neck dysfunction, every time your eyes move, your neck engages. And if you have neck dysfunction, that's going to worsen your headaches and worsen your symptoms. And so you're kind of just keeping yourself worse because you're not fixing the underlying neck dysfunction, that every time you do your eye movement, it's just causing those symptoms to just get worse. You know what I mean? Because there's a feedback loop between these two systems. Eye movement causes neck movement, and neck movement causes dysfunction in eye movement if there's issues with the neck. So that would be my kind of suggestion, is that there could be some underlying kind of foundational issues that still need to be addressed to help get more out of the rehab. You may just be seeing the wrong manual therapist. They just might not be getting to the crux of the issue. And you may just need to, sometimes you have to try 4, 5, 6 people before you find one that works for you. So it's a bit of a trial and error concept, but constant headaches, eye pressure leads to neck for me, but there's also this facial fracture that could be contributing to that same thing. So there could be compression on tissues. There could be sinus issues, especially if the fracture went through the sinuses at all. There could be just kind of chronic inflammation in the sinus.
Oh gosh, there's definitely chronic inflammation. I've been doing millions of things for that. Doing amino acid injections to kind of get the homeostasis in balance. And I actually have an appointment next week, I think, or 2 weeks, with My Vision First, and they basically do eye therapy, but he's based out of Maryland. But they do have an online program, I think, that might, I don't know until I talk to him whether he thinks I'd be appropriate for that, but my doctor here had recommended them as an alternative, because I do think it's, as you're saying, there's something with the eye. With the neck, yeah, probably. I don't have any pain, but it must be causing.
Yeah, a lot of patients that have headaches that are related to their neck have no neck pain at all because they're feeling it as a head. Like when a pain in a certain area gets so bad, you actually feel it somewhere else, right? Like the example we use all the time is the heart attack, where you're feeling pain in your left arm. Nothing wrong with your left arm, but it's just your brain can't interpret these types of chronic pain type signals very well, and it makes you feel that it's somewhere else. So a lot of times patients with neck related headaches don't have any neck pain at all.
How would I best communicate to a therapist about my neck, what they should do? What would you suggest?
I would suggest you find one that knows what they're doing, so you don't have to communicate that at all to them. So if you go to the resources and have you watched my manual therapy part 1 and part 2 series in the resources portal?
I don't recall.
So I would go and watch that. So it's a 2-part live presentation that I did where I break down the different types of manual therapy, who does what types of practitioners to look for, and then I kind of give you a step-by-step for how to find somebody that is potentially a good fit for you.
Okay.
So there's kind of a process to follow to figure it out. And then if you go to somebody that knows what they're doing, you really shouldn't have to communicate anything other than, I had this injury, I had this facial fracture, I'm having these constant headaches, I think it could be related to my neck, and so I'm here. And then they should be able to be like, got it, and let's go and figure it out.
Okay. Well, I think you've confirmed what I was pretty much thinking. It's got to be eye or neck related.
I think it could be, and it could be a combination of the two, right?
Right.
A lot of people make the mistake of going after vision therapy first. Vision therapy will not work if you have neck dysfunction.
Mhm.
With my two eyes not, because they're kind of getting lazy, would
Yep.
that be neck or would that be eye?
It could be neck, it could be eye, but it could be neck. And if you have neck dysfunction, the eyes won't move properly no matter how much rehab you do.
Okay.
So
Okay.
that's another problem that people get. Like vestibular, you've done vestibular for months and months and months and got nowhere. Doing vision therapy for months and months and months, and it's also very expensive. If you have neck dysfunction, you will not get anywhere with vision therapy alone. If you
Yeah.
don't have any neck dysfunction, vision therapy works great.
Yeah. Well, I know I've got dysfunction in the neck for sure. Maybe I resolved some of it, but probably not all of it.
Yeah. So my suggestion would be go back to 2.0 and like work through it again as if it's your first time. Just do all those things, and then I would try to go through that manual therapy 1 and 2 and like try to find a good neck practitioner to start that, and then add in vision therapy as well to the mix, and then you got the kind of whole package working, and you just be consistent with that for a while. Paul, Melinda, do you guys have anything to add to this?
No, I think you covered it there. I was just going to say a lot of what you just mentioned, where it's probably a combination of both. But one thing I'm just going to say as a general thought, kind of process for people that are listening to this, is that you kind of need to go step by step sequentially to go check off each one of these areas. And just because you've worked with a physio or a chiro, that doesn't always rule out there isn't dysfunction in that area, especially if you're collecting information from, for example, from this program that is really saying there's something going on with your neck. And you mentioned that you would never let a chiro manip your neck. To me, that right away is a red flag. That, especially because you said it's so tight. Well, that tells me right away that you probably had pre-existing neck dysfunction that probably has gotten a lot
Agree.
worse.
Agree.
If you wake up and your pain is a lot worse, that usually has to do with a posture that you have overnight. So that, again, a lot of that's to do with your neck, your jaw, how are you sleeping? And then as you get up, that things kind of move around and shift. So I think that manual care, chiro, absolutely. And even from an osteopathic perspective, the impact of that fracture to the left orbital bone has probably somehow impacted some of the nerves that come out. Like right over here, there's a little foramen, a little hole in the skull, and that there's nerves that supply the whole side of your face that come out right through this little gap. That can be impinged in some way. So there needs to be a multifaceted, multi-layered manual approach that are going to address the various things that can be dysfunctional. And so I think Cam's bang on is that go back to the neck and really have somebody that is going to work with you. Start slowly. But if you have a lot of restriction there, you don't need to do a high velocity manipulation right away. Maybe it's like just soft tissue work that you're doing for a period of months, and then they can move up to slow mobilizations and ranges of motion. But that's a good first place to start.
Yeah. The other thing just on the manipulation side is that a lot of people get, freaked out by it. Like no one's going to break your neck. It just doesn't happen unless they're doing really stupid things, which I mean, most won't. The whole thing with manipulation is that a lot of times if you have joint dysfunction, the muscles tighten up because of that. So your joints lubricate by movement. If there's no movement in a joint, they don't get lubricated, and you basically can't clear waste products out of the joint, right? Like for all the tissues in our body, our heart pumps blood, and that blood picks up the waste products and deposits oxygen and nutrients to the tissues. In joints, they don't have blood pumping into the joint. So the joint makes synovial fluid. The way that synovial fluid gets circulated and the waste products dispersed is through movement, right? And if a joint is stuck and it's not moving, what happens is you get this buildup of waste products inside the joint. Now that joint becomes inflamed and painful. Because that joint is in pain and inflamed and painful, it doesn't move well. And then the muscles tighten up around that joint as a protective mechanism. So you go in and you get some soft tissue work done to loosen off those muscles. Well, those muscles are just going to tighten right back up because the joint is an issue. So being afraid of manipulation is going to keep you kind of stuck, because if a joint is causing that soft tissue to be tight, it's just going to be tight no matter what you do. You can get all the massage you want. You might get temporary relief, but you're never going to get anything long lasting if the joint is what's causing those muscles to tighten up. So don't completely write it off, right? If you've had bad experiences in the past, I think a lot of it's about building trust with the practitioner. So find somebody who's willing to just start with soft tissue, right? Like I had a patient come in, this was years ago, but she had a 10-year history of dizziness because it happened, or no, actually it was like more like 20 years after somebody adjusted her neck. And she had dizziness from a neck adjustment that happened 15, 20 years earlier. So the first thing she said is, whatever you do, you can't adjust my neck. But the thing that was keeping her dizzy was the fact that somebody adjusted her neck and it was too far out one way and it had to come back to neutral. Well, the only way to get it back there is to adjust it. And so she didn't want me to do that. So I started with soft tissue work, and that gave her pretty good relief. But there's still this lingering little bit. And I said, look, I think you need an adjustment. And she's like really freaked out by it. And so we just started slow. I just started with mobilizations first, no adjustments, and then built her tolerance and trust in me till eventually said, you know what, just do it. And I did it, gone. No more dizziness. 20 years of dizziness, and it was coming from her neck. And if she would have just went back to that chiro, he probably would have fixed the issue 20 years ago. But because she got afraid of it and pulled back, well, now the issue didn't get fixed, and now she has 20 years of dizziness that she's lived with. And it could be an easy, simple correction. So I wouldn't completely write it off, but find somebody you trust, and you can go slow with it. And then I think if an adjustment is needed, it can be very helpful. So don't completely write it off.
So do you feel most chiropractors can do good manual therapy on the neck? Or go to more of a physical therapist?
Well, so here's the thing, right? So in that presentation, I talk about this, but basically just as a general rule of thumb, chiropractors tend to be better with their hands. Physical therapists are better with exercises and rehabilitation. Rehabilitation and exercises do not work for what you have. Okay, so you need the manual work. So typically that would be more likely to be, and I'm not saying this is cut and dry, but more likely to be chiro. Now the problem is that in the US, a lot of chiros only do manipulation. They don't do any soft tissue work. Whereas in Canada, a lot of chiros do a lot of soft tissue work as well as a lot of rehabilitative exercises and a little bit of manipulation. Whereas in the US, a lot of it's just crack, 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 crack.
Yeah, the doctor I have here, it does broad base, but I need to probably have a more focus more on the.
So in that presentation, you will see kind of what to look for.
Okay. All right. Very good. All right. Thank you very much. I appreciate your help.
You're welcome. You'll get there. It's just there's something missing, and it's neck vision. It could be some underlying inflammatory issues, especially you're talking about underlying inflammation. So take a run through 2.0. Do everything as if it's your first time. Just pretend that I'm just starting over again. I'm just going to do this because you'll knock a bunch off. You'll pick up some new things for sure. And then, find a good manual therapy for the neck and face, and then add in the vision therapy piece. And hopefully that'll start to get things moving.
All right. Appreciate your help. Thank you so much. Have a good day.
Yeah.
Hi, everybody. I was here the other week talking about my planned transatlantic flight, and I'm just in the process of starting to expose myself to a bit more. Like I went onto a rush hour train this morning, which went quite well. I don't know, I think this is more a question for Melinda, but I'm just looking for what I can do in the moment, like when I'm walking down my street to the station and I can feel myself sort of starting to react to the sensory input, just in terms of I've been through the experiential stuff, but I didn't know in terms of all those exercises what I could be doing while I'm in motion, just to sort of help regulate my nervous system, and what ideas she might have.
Sure, yeah, that's a great question. What do you notice happens in your body when you do start to get overstimulated?
I start to get sort of that visual disturbance, a dizziness, kind of just sort of restlessness, and a bit, hypervigilance. Yeah.
Yeah, so kind of more like an active response versus a shutdown response. And so sometimes we can kind of figure out, well, what type of response is it? Is it more of an active response where there's more energy in the body and you're feeling that restlessness, irritability, or anxiety? Or is it more this sense of being numb or shut down or, feeling like you need to lay down or take a rest. So because it's on the higher end of the spectrum, we want to shift into something like grounding. So that can be, as easy as just as you're walking, seeing if you can really feel into your feet against the ground, right? Noticing each step and the pressure of your foot against the ground or at the bottom of your shoe as you're walking, right? That gives your brain a task of one thing to focus on while you're in a stimulating environment. Because typically what happens in a hypervigilant picture is we're noticing all the stimuli and getting overwhelmed by it. And so what you can do in a grounding exercise is just bring your attention right back to the present, find your feet against the ground, and just focus there, right? Seeing if you can maybe even just look at one aspect of your experience as you're walking forward instead of noticing everything, sort of a more narrow, like tunnel focus almost, and just feel your feet as you're walking. You're also welcome to sort of use breath to support that. I don't know if that's something you've tried before, to sort of manage those busier or environments.
Yeah, I mean, I do try with the breath, but sometimes that's also affected. Like I get a bit of a stuttery breath, trying to sort of regulate using the breath. I mean, one thing I was doing was pressure, like my fingertips, using pressure on, alternating with my fingertips. But in terms of like trying to do it in a sort of measured way, I kind of lost track a little bit and got a bit overwhelmed.
Yeah, absolutely. I think just having like 2 to 3 things in your back pocket when you find yourself in an overwhelming situation can be so helpful to sort of help ground and support yourself in that moment. So you might try sort of finding your feet against the ground as sort of like mindful walking, but more just a grounding exercise. So we're really just focusing on the moment, finding our feet against the ground. It should have more immediate effectiveness than doing something like a 15-minute walking meditation, because it sounds like you need something in that moment. Another thing you can do, sort of like wall pushes, if there's somewhere you can go, if you excuse yourself to the washroom, you can kind of do a wall push. It helps to signal where your body starts and ends in space and contains some of that symptoms and emotional reactions we can feel in the body. So wall pushes are a good one. You could do a lunge as well while you're doing it. You can press your hands together tightly. So these are sort of just body awareness movements that you can do to help ground and support. Some of them are based in somatic, some of them are more mindfulness. We have a whole slew of them in 2.0. I don't know if you've started yet.
Yeah, sorry to interrupt. Yeah, I've listed out all of the different practices from the regulation module, and yeah, it was just trying to see if I could apply any of those just in the moment. Just in terms of the breathing, because that's something that I would like to try and sort of when I'm moving around and walking, and obviously in a few weeks' time I'll be going through busy airports and whatever. Just the sort of the pattern of breathing is what I'd probably like some guidance on in that moment.
Yeah, so sometimes breathing can be a trigger for more anxiety and create more hypervigilance. So if you notice that your breath gets, aggravated by, environments like that, you might try like slow breathing. So like an intentional slow breath. So a slow breath in for 4 counts and a slow breath out. The box breathing that you would have reviewed in the grounding and stabilization section, or the micro strategies lesson that you've been through already. Anything in those 2 lessons would be great to try as far as breathing. So there's the box breathing, there's slow deep breaths, there's sort of breathing in and out with one nostril at a time, right? The sense of how do I intentionally slow down the body's response to stimulating environments and balance out my nervous system. It sounds like for you, it's down regulating your nervous system, right? You don't need more energy.
Yeah.
You want to bring that down.
Bring it down, definitely, yeah.
So the 2 first lessons where we talk about grounding practices, stabilization, as well as the micro practices, those would be the 2 lessons that I would focus on for things you can do on the go, right? So trying them out, revisiting them, experimenting with them at home so that you have them in your back pocket ready to go once you get to the airport. So there are certain breathwork exercises in those to help you regulate in the moment. And what we've described in 2.0 is that any exercise in the micro practices or the grounding lessons have more immediate effectiveness versus something that you need consistent practice to obtain the benefits over time.
Yes, perfect. That's great. Thank you very much for that, Melinda.
You're welcome. Let us know how it goes.
I will do. Thank you.
All right. Go ahead.
Hi, I'm Emma. I'm here with my mom, Cindy. This is more of a question for Dr. Hrkal, I think. I actually took a GI map test because I was having so many like food intolerances and allergies and stuff. Can you explain the rest?
So we got her results back yesterday because the GI doctor and her primary care, they don't do what good bacteria and stuff is in your system. They search for parasites and inflammation and stuff, and she didn't have any of that. But the GI map that we took, they recommended like 4 different supplements, some probiotics and other things. Is there a specific order to take these, or can she take them all at once? Because right now her IBS is so severe, she only has like 3 or 4 safe foods. So she's got a lot going on with her stomach right now.
Yeah. So can I ask who recommended these particular products? Like, did she work with a provider that gave personalized instruction and prescription?
They're not prescription, they're just supplements. And we took an online stool sample and sent it into the lab, and then the lab came back, and then the program that we're doing, they are the ones that suggested the supplements for the issues that she has.
Sorry, what program is this?
It's called the Tiny Gut Health.
Oh, and in this program, it's like is there a person that you're dealing with actually that's like kind of taken?
Yeah, she has a one-on-one coach.
Okay, all right. Yeah, so it sounds like, in this type of very severe situation, you really would benefit from somebody that really takes a complete understanding of case and then gives recommendations, because it's hard to kind of give you a suggestion on where to start when it's as severe as kind of it's described here, right? I think you've done a good thing in trying to seek out information about your digestive system. The interpretation of that GI map test is very important because there's a lot of factors that GI map test looks at over and above just bacterial balance. So of course there's all the pathogenic things, parasites, candida, all that. And then there is the actual markers that tell you how well you digest food, inflammation at the level of the gut. So, I run this test all the time with my patients, and then I look at that result, and then I give people, a step-by-step recommendation. So obviously I am not able to see this and do this case, but in general, what I can say is that if there is a dysbiotic picture, meaning there's excessive amounts of bacteria or fungi that shouldn't be there, that usually is the first step to kind of eradicate those, or at least bring them to a more manageable level. That kind of approach is called a weed and feed approach. So you want to like weed out the bad ones, and then you have to have a period of time where you actually feed some of the good ones. And then you probably have to do a little bit of a weed again, then you need to do a feed again. That happens multiple times in cases of more chronic and ingrained dysbiosis. But, that being said, the first thing I do with patients is I help them break their food down better a little bit. So there's digestive enzymes and bitters and probiotics. So you can see how it can get a little complex, especially in cases of hypersensitivity like what Sydney has described here.
Yeah, she actually didn't have any fungi, and that wasn't a marker. And she is actually taking digestive enzymes, and that seems to help. So,
okay, so that's a good start. That's a good step for sure. That tells us that from a pancreas perspective and from a digestive hydrochloric acid perspective, there needs to be some improvement there. So and this is again where that one-on-one advice is so helpful.
mm-hmm.
When you implement a certain protocol. There usually is like, do these few things first, and then we'll see how you respond. If you respond really, really well, great. Maybe we need to press on that a little bit more. Maybe she needs more digestive enzymes. Maybe she needs to really go down that route. So whether things work or don't work, these are all key signs on which direction we should continue going. And this is why I really dug in on who's helping her and who's guiding her. Because there's such a personal, especially with gut, especially dealing with so many different multifactorial reasons you could be experiencing these symptoms. I find it so helpful of working with that functional medicine or naturopathic doctor to really give you that personalized advice, because sometimes it's like there isn't a protocol that works every time. It's like, how do you respond to it? How does it deal with this? Yes or no? Works or doesn't work? If it does, it means one thing. If it doesn't, we go down a different path.
Okay.
Okay.
Thank you.
You're on the right track, and hopefully that gives you a good place to go next.
Thank you.
Okay.
Good morning. I had a couple of questions. As far as like, I think my biggest, I was going through, I think it was the sleep module that I was going through, and I'm still working through the first module. I'm close to the end, so I wanted to finish that before I went through the new one. But something kind of caught my eye. I do have a lot of, sleep issues and vision and a lot, but something that caught my attention was, and the more I learn from you guys and other sources, I'm pretty confident I'm not at the right neuro-optometrist. But with my glasses, I do have prism glasses, but one of the first things that they put in there was like a blue light filter. So I'm wondering if my question is, with that blue light filter, my thought process is that that's filtering out the little blue light that I get, not little, but as I'm out and about even. Am I not getting the right amount of blue light because of that filter? Which my thought process is, if without that blue light and that changes during the day, that's part of what's affecting my sleep. I know there's more, but yeah, so that's kind of my first question.
Yeah. So, the issue with so you basically have a blue filter on your regular glasses.
Yeah, it's built into my lens. A yellow.
So the issue with that is that humans are not meant to spend all their time inside, right? They're supposed to be outside. We didn't evolve with sunglasses, right? We evolved to get full spectrum light from the sun into our retinas to tell our brains that it's daytime. And what happens is that through, our recent, the past 100 years, we don't spend as much time outside as we used to. So we're already getting less blue light than we're supposed to be getting during the day. And so now they put these blue filters on glasses, which means you're getting even less blue light than you should be getting. So generally the idea is that you don't want any blue filter throughout the day, and you want to be going outside as frequently as you can to get, uninhibited kind of light to your eyes, no sunglasses, that type of thing. And that's especially important first thing in the morning. So upon waking, you want to get at least like half an hour of direct sunlight, not looking at the sun, but like facing the direction of the sun and just having no sunglasses and getting that blue light to hit your eyes. If we're suppressing that all day, we're getting even less blue light than we're supposed to be getting, then we're already getting less than we're supposed to be getting because of just how, our modern society has become more indoors and less outdoor kind of work and stuff. So you want to suppress blue light in the evenings. So basically after, 7:00, I have full blue blocking glasses that I put on, so that I'm getting basically, I'm minimizing blue light in the evening. But then during the day, I don't wear sunglasses outside, and we shouldn't, have blue filters on corrective lenses that we're constantly wearing, because you're just getting less blue light. So it just kind of messes with your circadian rhythms. So that could be a potential problem. I know that's the stuff that Adit talks about. So she's our neurologist. And she's like a sleep specialist. That's what she does. She does sleep medicine. And that's one thing that she always says is that we're already getting less blue light than we're supposed to be getting from an evolutionary perspective. And that's already messing with our, our sleep levels. And then you put a blue filter on glasses, that suppresses it even more so, which then just, screws with the whole system. So she's really not a fan of blue filters on regular corrective eyewear throughout the day. But, blocking blue as much as you can in the evening is important. But having as much blue light as you can throughout the day is also very important. So I don't know, Paul, you're pretty good with sleep too. What do you,
Yeah, I think you said the right things, Cam. If these things are built in, then you can't turn it off. You're constantly having that filter. So I know that there's research showing that it can help decrease pain. But again, that's like a band-aid solution. That's like saying there's research showing Advil decreases headaches. Yes, it does. However, does it really allow us to get after the root cause? In this case, I think blocking blue light at night or in the evening and trying to get as much as we can, I would say it's probably one of the top 10 kind of post-concussion myths. If we were to do a myth-busting kind of series, I would include that, and like not hiding and blocking exposures to things that might irritate us in the short term, but we need to build that tolerance. And I think light exposure is a good example there. So yeah, I agree. I'm not a big fan of putting in any sort of lights or any sort of lens tinting in your regular everyday glasses, but there could be a role for temporary use while we are trying to get some care rehabilitation done.
Yeah, like for example, if you're using a computer and that's tough, you might want to consider using the blue filters for that purpose only. But then throughout the rest of the day, you want to swap it out for glasses that don't have that, so you can go outside and let the sun hit your eyes, right? So that's an important one.
Okay. Yeah, no, I'm almost 3 years out, but what they've done is, I'm in prism lenses and we're still tweaking that, but one of the first things they did was add that blue light filter. And then, I have sunglasses for light sensitivity and all of that, and they're dark and polarized. And I know that's not right. I mean, I know it probably was helping my symptoms immediately, but it's not helping me in the long run. So, anyway, I have a follow-up appointment next week. So I was just trying to work on some questions. So,
yeah, it's kind of like short-term gain for long-term loss, right? Like they do that because you're going to be like, oh, I feel so much better now, right? But the problem is you're actually making yourself weaker over time, right? It's like an orthotic in your shoes, right? So the whole idea behind orthotics is people will have like a fallen arch, or they'll be overpronating or something like that. So the prescription is, okay, well, let's give you an orthotic. Whereas, the way that to really look at it is, okay, why are they overpronating? Is there a hip issue? Is there a gait pattern issue? Do they have weakness in the muscles of their foot? Can we strengthen the muscles of their foot to hold that arch better? That's a better long-term solution. Because what happens with an orthotic, it's like putting a cast, right? If you've ever seen somebody, like, you break your arm, you put a cast on your arm, and after 6 weeks, if you take that cast off, your arm is skinny because the muscles immediately start to atrophy because they don't have to do that job anymore. Your body's very efficient. So it's going to take from areas you don't need, and it's going to move it to areas you might need those resources. So my arm isn't moving anymore. I don't need muscles. So I'm just going to eat them away. I don't need them anymore. And so they atrophy really quickly. Same thing with the muscles in the arch of your foot. If I put a cast on that and I don't have to try and hold my arch anymore, those muscles are going to atrophy down to nothing. And because of that, you're always going to need orthotics because your foot has now weakened to the point where you can't even sustain your own body weight on it. So you need an orthotic to artificially hold your arch. Well, the same thing's happening here. It's like, yeah, you put that orthotic in, you feel great. Well, my feet feel fantastic. I love these orthotics. This is beautiful. But now you can't live without them. So it's the same type of situation that happens here. Oh, these blue filters, everything feels calm. It makes everything relaxed. I can wear these sunglasses and I don't have this light sensitivity anymore. I can function better. But guess what? You're actually making your body more sensitive to the very thing that you're avoiding, to the point where now you can't even take them off because everything now seems even more heightened, more sensitive, right? So it's kind of short-term gain for long-term loss. And so rather than giving you the orthotic, in this case, the glasses, I would say, let's increase the strength. Let's start strengthening your foot. And in this case, let's start increasing your exposure so that your body learns that this is actually safe and this is okay, right? So you just gradually build your tolerance to these things. Like anything, like lifting weights. If you're going to go to the gym and you're going to be like, I'm just going to try and lift 400 pounds today, you're going to crush yourself, right? But if you say, my goal is to get to 400 pounds eventually, I'm going to start with 100 pounds and I'm going to gradually increase the weight as my strength builds, and I can add more, and then I can eventually add more, and eventually maybe you get to that point. But it's just about adding incrementally and building up slowly. So it's the same situation here. It's building that tolerance.
Right. All right. Perfect. Thank you, guys.
You're welcome. Okay, next up is...
Hello. Can you hear me?
I can.
Fabulous. Firstly, I want to say thanks. I've only found your program a week ago, so I am just only on the sleep hygiene phase, which actually I did implement a lot of stuff yesterday, and I got to sleep a lot quicker. Nice. And my thing is, I'm quite lucky because I'm still quite early in my journey. I had a car accident about 9.5 weeks ago. I did see a neurologist this morning. It's the first person I've seen who might have some information, but to be honest, from doing your program, I've already learned a lot. My question is, since the accident, I've noticed I've had a leaky bladder, and I don't know whether that could be, I've not got to your hormone section yet. My health prior to the accident, I had about 18 months where I was not, basically since then I was diagnosed with perimenopause. So I'm not sure whether this has triggered my hormones to be more dysfunctional, whether it's something I will find out later in the course, whether it's could be related to the accident, because the person I saw this morning said it's unlikely it is. But it's happened since then. So I'm just kind of thinking, obviously I'm quite early on your course. Is this something I will learn? Is this something I'm now going to be stuck with? Or is it something that as I go through the course, I'll my body will start to heal and it could help it?
Yeah. So just to understand, you're saying that you have urinary incontinence that came on after the concussion, didn't have it before?
Yeah. So I will go to the toilet and then feel like I've emptied my bladder. Mm-hmm. And then as I'm getting up, it's like there's extra liquid.
And so again, this is new. This is post-concussion.
This is new, yeah.
Yeah. And did it happen right away, or is it something that kind of has come on over a period of time?
I'm trying to think, because all my other symptoms came on 48 hours afterwards. This, I probably would say it came on within the first week.
Mm-hmm. Okay.
So I'm at my 9.5 week mark now.
Yeah. Can I ask how old you are?
I'm 43.
Okay. So it's pretty common that this can happen as a woman goes into the menopause and perimenopausal transition. Mm-hmm. There are a lot of muscular changes that happen in the pelvic floor region.
Yeah.
So there is a pelvic floor physio that you can go and see to help you with this. However, because it's come on after a concussion, my suggestion is that this is probably a nervous system connection, because again, our bladder and the sensors in the way the bladder expands, those sphincters, basically the doors that close from the bladder from coming out through the ureters, they can sometimes be impacted by a hypersensitive nervous system. So my suggestion is that because it's only been 9 weeks, I know it seems like a long time, but it is short in the concussion world.
Yeah, yeah. I'm realizing this from seeing other people's stories. I'm like, how do they manage for 2 years?
100%. Yeah.
9 weeks has been a nightmare, not working and stuff. And I've got a dance contract that starts in November. So I'm trying to get my fitness back for then and to be okay for then.
Well, I hope you're in the right spot, because a lot of people get really big improvements right away after working through the program. So I think that's perfect segue into just as you said, as you suspected, work through the program, implement all of Melinda's section. That nervous system regulation piece is so helpful to kind of get that nervous system out of that fight or flight mode.
Mm.
And the ability for the body to toggle between sympathetic and parasympathetic nervous system is really what allows us to be resilient and allows us to deal with any sort of stressor. And the shock of the concussion, the shock of that on the sympathetic nervous system, on the autonomic nervous system, this is really, really could be impactful. Now, it's not common that you get urinary incontinence after concussion. I know Cam, Melinda will tell you, we see a lot of patients. That's not a common thing that we see, but I think it's plausible that it is going to be impacting your ability to kind of just shut down. Obviously, you can kind of compensate for that with just, I'm just going to do a quick little get up, make sure it's all gone, and then move on. So there's little.
Yeah, I'm trying to do that. Yeah.
Yeah.
Okay, that's cool. I think what struck me in your course is the good old days theory, where we're all like, oh yeah, before the crash, I was amazing and everything was great. Well, but actually for me, I know that I've been in fight or flight mode, and I was in a situation in 2023, and I'm not sure whether that then triggered all this sort of similar to hormone things. But it's given me a lot of food for thought to look back and say, actually, how much was I in good health beforehand? And actually, I know I wasn't. I mean, I used to be very fit, physically fit, healthy, everything. But so I think your program is going to help me on many levels, not even just the concussion one. So I just want to say thank you.
You're welcome.
Yeah.
You're welcome. Great point.
I wanted to add to that too, because I find that it's so common when we're living with post-concussion. I know in your case, you're only 9 weeks out, but for people who are years out, I find they end up in a comparison thing. So I used to be like this. If only I didn't have concussion, I would be able to show up the way I used to. But often we forget about things like aging, and for women, perimenopause, and just general ways we grow out of certain phases in our life where we might not be able to have as much energy as we used to, or do some of the things we used to. So some of it isn't really related to concussion. It can just be related to other journeys that we're on due to our age and how things have changed over time. So I think you raised an important point, not just for your own reflection around perimenopause, but for other listeners today, is how things can change over time. And for individuals who've been living with PCS for 2 to 3 years or even longer, just noticing that comparison that can happen when we say, if only I could get back to the way I was. But whether or not you had PCS, you may not get back to the way you were because you're older and things have changed. And, there's so many ways that even our interests and our hobbies change, or the things we would want to do with our free time change. So I think sometimes just that mental shift of like, wait, do I really want to get back to who I was? Because the likelihood is that even without PCS, I probably would have evolved anyways. So I think that's an important piece that we often forget about, and something you're sharing with us that can be helpful for other members too. So thanks for that.
No, right.
Yeah, you don't remember what it's like to be just a normal person, right? Like, you're not 20 anymore, and so you start remembering. If you ask my mom, she still thinks she's 20 years old. She's 70, whatever she is, so she still thinks she's 20. So like in her mind, that's where she should be, but she's not. So it's one of those things. But the other thing too to consider is that if you go through the program and this is still an issue, you could also consider like some pelvic floor physio, just to work on the muscles of the pelvic floor, because that can help with this type of symptom. So it could be related, it could be completely unrelated in just the phase of life that you're entering. And so do the things in the program, and if that helps, great. If not, then you may want to just explore this as a separate isolated issue, and look at maybe some like pelvic floor work.
Okay, thanks. I was looking at that as well anyway. I've got a fitness background, so I'm quite aware of pelvic floor and stuff. So yeah, I was like, okay, maybe I do need to focus on that more as well. I can do it alongside this. There's no harm. So
right. Yeah. You just don't want to overload yourself too quickly with too many things, because that just can backfire on you. So, just take it slow, like focus on this type of stuff, first. And okay, I've done all this stuff. My concussion symptoms are gone, but this issue's still there. Now it's time I can work on that as an isolated thing. Because like Dr. Paul said, you may not need it if you do all these other things. And it may be just because of these things. So don't overload yourself too quickly, and just,
Thanks for saying that. I've got ADHD, so I'm like, get so hyper focused. I'll be like, right, let's just do everything. And then I've got to pace myself. And
yeah, well, that's a lot That's a lot of concussion patients. A lot of people do that. They want to try and do everything all at once, and it just doesn't work like that. So it ends up, they kind of go in circles and spin their wheels because they're trying to do too many things. So I think just stick with the plan right now that you're doing in this program, because then a lot of that will probably resolve. And then if not, you're left with this one kind of isolated issue that you're like, okay, that's now where I'm going to focus.
Yeah. Okay. I think it's good the way you do your program. So you have to kind of follow it step by step. You can't just jump forward, because already I'm like, I want to know the nutrition bit, because I'm already following anti-inflammatory nutrition myself, because I'm like, that might help. But I was like, no, got to calm down. Just do this bit first, this bit. So it's good the way you do it. So
yeah, we get a lot of complaints about that.
Yeah. But the other side of me is going, God damn it. Let me have the nutrition information.
I just want the neck piece, so I'm just going to skip everything and get to there. But the thing is, it doesn't work like that. So even if you skipped ahead to nutrition because you hadn't done the previous steps, it wouldn't have the same impact it would have you done it the right way. So that's
100%. So it's good to do it that way. I understand it, even though if part of my brain's going, why can't we have it? But yeah, so you're doing the right thing. Thanks.
Okay, last is.
So I have a few questions. You can let me know time-wise, like what we have time for. But I'm 4 months out post-concussion, and actually, I don't know if this is helpful, but before concussion, I was dealing with mold toxicity, working on trying to slowly start detoxing, and then kind of in that process, ended up getting my concussion. One of the biggest issues for me, like especially presently and like the whole time, it's gotten better, but it's still here every day at some point, is the ear whooshing. So I don't have tinnitus that's like the ringing like all day. I'll notice it like at night when I'm sleeping, if like I have an ear down on my pillow or like an earplug in, just to, because I'm a really light sleeper. But other than that, like the tinnitus like that doesn't affect me. But the whooshing comes like, especially like it even happens a little bit now because I have like my phone, kind of near my head, but it feels really Wi-Fi related. I definitely have EMF sensitivity, and I had that too with mold toxicity. But I didn't have like this with the mold toxicity before concussion. So it definitely gets triggered if I'm like around like loud noises and Wi-Fi, or if I'm just feeling activated like in the moment for whatever reason, it definitely gets worse. And it's not like impairing but it's just super annoying. And so I'm working with a doctor, especially on neck stuff. Neck has been an issue for me. And this doctor was trained by you guys. So he's kind of been like, yeah, like, let's see if it kind of goes away over time. It is probably getting better, but I'm just curious if you have any like input. I haven't seen an ear, nose, throat or anything like that.
Do you experience this? So this is actually called pulsatile tinnitus. So it is a form of tinnitus. It's called pulsatile tinnitus. Do you experience this only when something is against your ear, or just if you're out and about?
Out and about, yes. Like
both sides, one side?
It's only my left side.
Okay. So pulsatile tinnitus is generally due to a few potential causes. One, if it's something like when something's against your ear, you basically are, this just has to do with, this is just normal physiology. If something's against your ear, you can hear your pulse. You can hear your pulse louder if your blood pressure is higher for whatever reason. So for example, if I have, a few glasses of wine at dinner, I will hear it louder than if I don't. Right? So it just changes my blood pressure is probably increased and my body temperature is elevated, my heart rate's elevated, so I can experience that, which also kind of lends to the idea if you're under more stress, you hear it more, right? So that it could be just due to that factor. Now, if you're hearing it generally when you're not something against your ear, because there's two different types of auditory stimulation. One is air conduction, meaning when somebody's speaking, you can hear that. The second is bone conduction, where you hear things louder that are inside your own head. So if you plug your ear and you hum, right? So if you just plug one ear and hum, try that now. Just plug one ear and then hum.
Mm-hmm.
Which side do you hear it louder in?
Oh, I have to plug both my ears.
Oh, plug one.
I don't know. It's super hard to tell.
You'll generally hear it louder in the ear that's plugged.
Yes, that is true. I did both sides. Yeah.
Okay. So you'll hear it louder in the ear that's plugged. Why? Because the air conduction is not there anymore. So you hear more of the bone conduction, which is what's going on inside your head. So that humming is the sound reverberating through the bones of your skull. And you're going to hear that sensation louder when the ear is plugged. So when you're lying on a pillow and the ear is plugged effectively, or you have an ear plug in and the ear is plugged effectively, you're going to hear more of what's going on inside the head, which is your pulse, your heartbeat, the whooshing of blood passing through the arteries that are around your ear. If the blood pressure is higher, or your body temperature is elevated, your heart rate's elevated, or you're under more stress, that is going to sound louder. When I remember hearing this as a kid, I used to think it was footsteps coming down the hall. I'd be lying on my pillow and being like, somebody's here, somebody's in our house. And I would get nervous about it because I could hear tch, 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 but it was just my own pulse in my ear. So it's normal when your ear is plugged to sometimes be able to hear your own heartbeat. That's the whooshing sound.
Yeah, it's interesting too, because and this is probably still what you're talking about, but like when it is happening, it's at the end of every sentence that I'm speaking, or like, I guess I'm listening to somebody. It's consistently happening with like loud noises, but when I'm speaking, it happens at the end of my sentence.
So once the air conduction stops,
Yeah.
You know what I mean? So as you're speaking, that you're getting more air conduction. So it's basically suppressing that sound. But when you stop and things go quiet, like people hear tinnitus most frequently when things are quiet. Because when they're not having that stimulation, then all of a sudden the nerves are picking up, the tinnitus. So same kind of thing. Now, if you're out and about and you're hearing this whooshing, that could be due to elevated blood pressure, right? So if you're experiencing it more with stressful situations, it could be that you're right. So, or a response to like EMF, Wi-Fi, whatever, your heart rate, blood pressure increasing, and then you're starting to kind of hear this whooshing sound. It also could be due to like hardening of the arteries in and around the ear. So if you have, or tortuous arteries, meaning that there's a lot of curves and twists, which means that the blood flow is gonna as it goes through. It's gonna whoosh as it goes through. It's not gonna be nice and smooth. So if there's calcification of the arteries, that can make that sound more. And then, like I said, blood pressure and those types of things will make that sound more because that blood is just reverberating around in there and your ear is hearing it. So it could be related to just like stress. It could be related to, all these types of things that we work on in this program. So I would kind of agree with your practitioner of like, let's see if it goes away over time, especially by doing some of these things, right? Like following the diet and getting good sleep and all that stuff will probably lower your stress responses, lower your blood pressure overall, and that could help to get rid of it. It could be obviously neck dysfunction because blood's coming up through the neck, and so there could be some elements there that are contributing to it. But ultimately, if it's still there, you want to do some investigation to see like what do the arteries around the ear look like? Is there calcification going on in those arteries? What's your blood pressure? Those types of things.
Okay. Yeah, that's super helpful. Thank you. Do we have time for like another question?
Sure.
This might be a little bit more of a question for Dr. Hrkal, but I definitely had hormone issues from the mold that I was specifically in prior to concussion. And post-concussion, I didn't experience like emotional ability the first couple of months, but the last 2 months, I'm like super noticing emotional, like related to my cycle, emotional ability, like this huge despair that's coming different times of the month, or like immense irritation. And I know, from going through 1.0 and 2.0, like this can be really common. I'm also a psychotherapist, and so I like have a lot of education and like training in like this area, but it's just like these like waves that come, and it's like so hard to regulate. And I've trying to implement and have been like all the sleep stuff and the diet stuff. I've eaten paleo for like 10 years. And I just, I'm curious about that piece and how to like support myself in that, or if there's like, I know that there's like, supplements talked about in the hormone section, but just curious.
So, I mean, it's very common for women to get transient hormonal changes or changes in their PMS, and that's, I think, what you're referring to. after a concussion, and it can come on sometimes months after. In fact, the hormonal changes, probably out of all the symptom kind of areas, they're the ones that can have the most delayed onset, because the impact on the brain hormone control centers can be so slow, and really doesn't manifest as symptoms until months later, after that inflammation or even changes in blood flow to certain pituitary areas can actually manifest as a deficiency. Maybe it's not a total pituitary shutdown, and this is why I think this is such a complex area, is because clinicians in the more conventional side of things, like neurologists and interventional endocrinologists, they're like, all or none. They're like, do you have pituitary failure or not? Well, what about all the shades of gray, which a lot of people can have, brain fog and fatigue and some of the changes you have. But that being said, that's kind of the classic impact after concussion. Most of the time, in my experience, it's the effect of stress. It's the effect of the body's sympathetic and parasympathetic balance, or in this case, often imbalance, and the body's adrenal system that helps control your other hormonal systems. Like if you look at the cascade, once you get to the hormonal section, there's a great graphic that I show where I kind of say concussion is a whole body issue. It's not a brain issue. I know that everyone enters the door through the brain, but the impact, once you start understanding that it is multi-organ and multi-system, the adrenal system is one of the first systems that's impacted. Because we think about, right, what's the main kind of fight or flight hormones? Well, they're catecholamines, they're adrenaline and epinephrine. And what system produces that? The adrenals. They're named after adrenaline, which was the first kind of hormone that was found. So it stands to reason, just on that logic, that if you're kind of going through some of these symptoms, and you went through that mold toxicity, and you went through different stressors maybe in the past, that your body's adrenal system has to pick up the slack. So there's a lot of factors that have to be assessed. Obviously, working with somebody that's well-versed in this is the first recommendation. But I think to get started, look at the adrenal section when you get to that part of the course, and really try to see if there's things you can do to help support that, because that often will help balance some of these other maybe more subtle changes that happen in the PMS and hormonal realm, because the adrenal system controls or helps influence those systems.
Okay. Yeah. Yeah. Awesome. Thank you. And the last question, which is probably just a quicker question, I'm like getting a lot better with using screens and reading. But I'm finding like if I get like sucked into work or doing research for like 5+ hours a day on screens or reading, I like get to sleep and I'm like hover sleeping. It's like I like sense myself sleeping. I'm like not entering deep sleep. And in the moment though, like I don't really, it's not the feeling of like, oh, this is painful, I should stop. But then I like pay for it when I sleep, which of course just like spirals like for the next week of just affecting all the other areas. Yeah, do you have any advice with that?
I would say just pay attention to what it is. Like what's the time period that you can do before that happens, right? It's like, like training. Like if I have a really hard training session, my sleep that night will be off because my body is just under stress from trying to recover from that training session. So it's kind of a similar thing where you're just doing a lot. Your mind is kind of going all day. That's like, it's kind of a stress response on the body, right? So just find what your time period is, right? If it's 5 hours, okay, let's like keep it to 4 and see if that is better. And once you find that kind of sweet spot where it's like, okay, I can do this amount of work and be really into it and it doesn't impact my sleep, then just stay there for a few weeks and then gradually add a half hour to that and then see what happens, because then you're building tolerance over time. So it's like training. If you do too much in one day or one session, you're going to pay for it at night. You're not going to be able to sleep as well. Your deep sleep isn't as good. Your resting heart rate doesn't lower as well. All these things happen with your sleep. But then as you kind of continue to train and do that, then now you can do more volume and have less impact, right? So it's just kind of getting your body in shape in a way to be able to tolerate that. But it may just be that 5 hours is too much. Maybe 4 hours is good for now. Stick with that for a few weeks once you find that number. And then just add, like, incrementally add a half hour to that and stick with that for a few weeks and see how that does. And then add another half hour, stick with that. And so you can build tolerance towards that.
Totally. That makes sense. It feels like the exercise a little bit too, which makes sense. Yeah. Okay. Yeah. Thank you all so much.
I was also thinking just that sense of like nervous system regulation. So with sleep and mood symptoms around your cycle time, we can think about, you know, our nervous system as oftentimes being quite dysregulated following concussion. So even if we're a clinician ourselves and we know all the things and we're implementing all the things, sometimes it could be helpful to sort of like really slow it down and focus on just a few regulation strategies to support what you're experiencing as you're going along. So, you know, I don't know if that's relevant for you, but we have had lots of clinicians on here who talk about how they forget to sort of, you know, go back and, you know, put on their learner hat, and they're sort of still in the clinician mindset. You know, I know these things intellectually, but maybe it could be helpful actually to slow down and implement them as a patient. So just an invitation there to think, you know, whether that's relevant for you and ways that you can support yourself with the existing challenges as you're working towards resolving some of these symptoms you're having.
Yeah, absolutely. Yeah. Thanks, Melinda. Super good reminders.
Great. And it's a great spot to wrap up today's Q&A. Thank you for all those who came on, who asked questions, who listened, who offered support in the chats. And hope everyone has a fantastic day. Bye.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.